Every doctor, nurse, and healthcare provider must go through a rigorous process to prove they are qualified to treat patients. This process, known as medical credentialing, is the foundation of a trustworthy healthcare system. Without it, hospitals, clinics, and private practices would be at risk of hiring unverified professionals, jeopardizing patient safety, and leading to serious legal and financial consequences. But here's where things get complicated. Credentialing isn't a simple one-time check. It's an ongoing process involving extensive paperwork, strict regulatory requirements, and constant updates. One small mistake can delay insurance approvals, disrupt patient care, and even put an entire practice at risk. So why is credentialing so difficult? And more importantly, how can healthcare providers navigate this complex system without being buried in administrative work? This is where Credex Healthcare steps in. They developed a solution that takes the stress out of credentialing, helping doctors and clinics get approved faster, avoid costly delays, and focus on their true purpose, caring for patients. Stay with us as we uncover how Credex Healthcare is changing the game. Picture this: a doctor's office buzzing with activity. Patients fill the waiting room, some nervously checking their watches, while a receptionist scrambles to confirm insurance details. Behind closed doors, a physician flips through stacks of paperwork, sighing in frustration. A crucial insurance enrollment is still pending, delaying payments and creating financial strain on the practice. Now imagine this scenario playing out in hospitals and clinics across the country. Every day, medical professionals face a hidden challenge: ensuring their credentials are properly verified, maintained, and approved by insurance companies. Without this step, doctors can't legally see patients, bill insurers, or even practice medicine. The process is anything but simple. Credentialing requires verifying medical degrees, licenses, certifications, work history, malpractice records, and compliance with federal and state regulations. Every document must be meticulously reviewed, every detail must be accurate, and any minor mistake can lead to weeks, or even months, of costly delays. For small practices, the burden is even greater. Without a dedicated credentialing team, doctors and administrators are left to navigate an overwhelming maze of forms, deadlines, and ever-changing regulations. One missing document can mean rejected insurance claims, revenue losses, or even the inability to treat patients. But what if there was a way to bypass all this hassle? A system that streamlines the credentialing process, eliminates costly errors, and ensures that providers get approved quickly and efficiently. That's where Credex Healthcare comes in, offering a game-changing solution that takes the complexity out of credentialing. Let's explore how they do it. Now here's where things get really interesting. You'd think that in today's digital age, verifying a doctor's credentials would be a straightforward process, right? After all, these are life or death qualifications we're talking about. But the truth is far from simple. Behind the scenes, medical credentialing is a tangled web of paperwork, regulatory hoops, and outdated systems. Each healthcare provider must submit dozens, sometimes hundreds, of documents, from medical school diplomas to state licenses, board certifications, malpractice history, and hospital privileges. And that's just the beginning. Once submitted, these credentials go through multiple layers of verification: state medical boards, insurance payers, federal databases, each with its own set of rules and requirements. If even a single piece of information is incorrect, missing, or outdated, the entire application can be rejected. A minor clerical error, like a mistyped license number, can delay a doctor's ability to practice for months. And here's something most people don't realize: insurance companies aren't in a hurry to process these applications. Credentialing with a major payer can take anywhere from 60 to 180 days, sometimes even longer. For a newly hired doctor, this means sitting on the sidelines, unable to treat patients or generate revenue, all because of bureaucratic red tape. But the consequences don't stop there. If a provider's credentials expire or aren't kept up to date, they can be dropped from insurance networks without warning. Suddenly, claims are denied, revenue vanishes, and patient care is disrupted. Entire practices have been forced to shut down due to credentialing failures. So what's the solution? How can healthcare providers avoid these pitfalls and ensure their credentials are processed quickly and accurately? That's where Credex Healthcare comes in. They crack the code to fast, efficient, and hassle-free credentialing, ensuring doctors and clinics never get caught in the nightmare of delays and denials. But how do they do it? What makes their process so different? Stay with us, because we're about to uncover the secret behind their game-changing approach. And this is where everything changes. Imagine a world where doctors don't have to chase down paperwork, fight endless delays, or lose revenue due to credentialing issues. A world where they can focus entirely on their patients without the looming fear of administrative chaos. That's exactly what Credex Healthcare has made possible. Unlike traditional credentialing services that rely on slow, outdated methods, Credex has revolutionized the process with a system designed for speed, accuracy, and efficiency. Here's how it works. Credex takes over the entire credentialing journey, from verifying medical degrees and licenses to handling insurance enrollments with major payers. They don't just process paperwork, they anticipate issues before they arise, ensuring every detail is correct and up to date. With a team of experts who understand the ever-changing regulations, they eliminate costly errors that cause delays. But the real game changer, their use of advanced digital solutions. While many credentialing services still rely on manual processes, Credex leverages technology to streamline applications, track expiration dates, and provide real-time status updates. This means no more wondering if an application is stuck in limbo. Providers always know exactly where they stand. For doctors and clinics, the impact is immediate. Instead of waiting months to be approved, providers can get credentialed and enrolled in a fraction of the time. Faster approvals mean quicker insurance reimbursements, increased revenue, and most importantly, no interruptions in patient care. And here's the best part. Once a provider is credentialed, Credex doesn't stop there. They offer ongoing monitoring to ensure credentials never lapse, keeping practices fully compliant with state and federal regulations. No last-minute scrambles, no unexpected denials, just smooth, hassle-free operations. This is the moment healthcare professionals have been waiting for. The days of lost revenue, rejected applications, and never-ending paperwork are over. With Credex Healthcare, medical credentialing is no longer a barrier. It's a seamless, stress-free process that lets doctors focus on what truly matters, saving lives. But what does this mean for the future of healthcare? And how can providers take advantage of this breakthrough solution? Let's find out. If you found this video helpful, don't forget to like and share it with others who might need it. Subscribe to our channel for more insightful content, and hit the notification bell so you never miss an update. Have any thoughts or questions? Drop a comment below. We'd love to hear from you. Thanks for watching, and see you in the next one.